Right then, welcome back. Still Breakfast Central on News Central. We're going straight to the big story this time from Kenya, all about the new variants there. With a population of about over 52 million, the country recorded its first coronavirus case back in March 12, 2020 last year. Now, there are now a total of over 100,000 cases with about 83,000 recoveries and over 1,000 deaths in the country. Now, as talks of vaccinations continue, globally, Kenyan scientists have raised alarm on a coronavirus variant discovered in the country, which they say differs from the one spreading in both in South Africa and the UK. Now, about 10 investigators from the country Medical Research Institute discovered a mutation of the virus responsible for the disease between July and October last year.
Now, Dr. Charles Agoti, a principal investigator and researcher, says that the variant unique to Kenya was detected in a batch of samples taken from Taita Taveta County. We also know that, according to him, the variant has one change that is suspected to be of significance, unlike variants in South Africa and the UK, which had 8 and 9 changes, respectively. Meanwhile, a statement from the World Health Organization says that various concerns or variants of concern, which are on the rise in 47 countries in Africa, may impact a person's immune response and need to be investigated further. There are concerns being raised about the risk factors of the new variants, how they may respond to the vaccines, and where this leaves Africa.
And to join us on that one, we're joined by Dr. Moses Masika, a virologist from University of Nairobi in Kenya. Dr. Moses, good morning to you.
Good morning, sir. How are you?
We're great. Thank you so much for joining us. So quickly take us through what information Kenya has right now regarding the Kenyan variant.
Yes, just background that Kenya so far has reported about 100,000 cases and just about 2,000 deaths. And out of these 100,000 cases, only 500 have been sequenced, meaning only 500 have been analyzed to the level of detecting such variants.
Wow.
And one of the variants, out of maybe about 25 variants discovered in the country so far, only one of the variants is that was described was identified to be that first seen in South Africa in October 2020. And the reason people are concerned about it is mainly because the variant has been tested in the lab, and because of a mutation on the surface that makes the virus escape our immune defense systems. It has been observed that it elicits, or it is able to avoid neutralization by antibodies from some people through testing their blood, and these are people who have already been infected.
Wow.
So this is the concern. Luckily, or unfortunately, one of the gaps is that although in the lab you may see a variant that has that is not neutralized by a patient's or a person's immune system, you may have the body in real life being able to neutralize such a virus through different mechanisms, because the immune system is very complex. So although that is a concern, it does not necessarily obtain in the natural environment, and that is a question that we still need to answer. So I would say that there are different variants so far that have been described. Unfortunately, the number that has been sequenced, 500 out of 100,000, is not sufficient to say that we know all the variants in the country, but this particular one has caused a concern because tests in the lab in South Africa have shown that the virus or variant is able to escape neutralization.
Dr. Moses, before we let you go, in your opinion, as a virologist, studying and following this, disease since it broke out, the new variant, what do you think African countries can do in terms of to better prepare to respond to the new variants?
One of the main gaps that we see in Africa is sequencing. Sequencing is deeper analysis of positive samples to be able to identify circulating strains and variants. So we've not done this in Africa. Out of hundreds of thousands of sequences in different databases across the globe, only 6,000 are from Africa, and half of these are from South Africa.
Doctor, do you mean gene sequencing here? Are you talking about gene sequencing?
Yes.
Okay.
For COVID-19, yes.
Okay.
So because of this, that information is useful to help us monitor what variants are in our continent, and we link this to clinical presentation, to transmission data, to reinfection data, because we need to start collecting information for people who get reinfected. And this will help us to stay ahead, to know whether the vaccines that we are planning to give our people are working, and whether we need to even review our diagnostics or diagnostic tests or any other interventions that we are putting in place for COVID-19. So that is one thing. The second thing is for us to fund research more. A lot of researchers in Africa have not had enough funding and to be able to make interventions that are custom made for Africa. So even for things like developing vaccines and lab tests, if we fund our researchers more, we should be able to see at least for future pandemics and even going forward for COVID-19, more interventions that are customized for Africa coming up much earlier than waiting for the rest of the globe to come up with solutions. Then we take those up in Africa.
All right, Dr. Moses Masika, virologist at the University of Nairobi in Kenya, thank you so much for joining us. Thank you for sharing your knowledge on this situation with us as well. And we definitely will be talking to you sometime soon again.
Thanks for having me.